guests on Keel, even the most regular ones, appear via the Jack Spring Electric Keel Newsmaker hotline. Dr. Martha Whyte, Regional Director, Louisiana Office of Public Health. Hey, Dr. Martha, welcome back to Keel. How you doing?
I'm doing fine. How are y'all?
So, is the worst behind us? We over the hump? Is it all pie and champagne from here on out? How are we looking? What's the latest?
So I wouldn't go that far. I would say that we are seeing definite improvement. We are seeing less people admitted to the hospital. We're seeing less people put on ventilators. However, we're seeing still a continued rise in number of deaths. So, and then we also this weekend did not see, a good practice of social distancing in many areas of the state. So, we're very worried about what we're going to see in the next few days.
That was a result of Easter Sunday, I guess. People getting together with family and all that, correct?
That's correct. Right. We've had a lot of large church services as well as a lot of large gatherings. So,
what's the key figure you're looking at to see optimism?
Well, I am optimistic about what we've been seeing. So it was, it's exciting to see that fewer people are going into the hospital and fewer people are going onto ventilators. It's just we have to see kind of a longer response. We have to see people not to give up on these practices because it's the practices that we're doing that is making a difference. So, we need to see kind of a longer flattening of that curve instead of, everybody asks, are we at the peak? We don't really want to ever hit a big peak. We want to kind of flatten that out and have it go a little bit longer with fewer people as sick.
Does it worry you, Dr. Whyte, to hear some folks say, we need to get this economy back open. We need to start letting people go back to work. Is that premature in your view?
Right now, yes, it's premature. I absolutely agree that people are struggling, people are suffering, and we need to do what we can when we can. It's just not quite the time. We've seen this in previous pandemics where people, let down their guards, and then we had another huge second wave. We don't want to do that this time. We want to make sure that we're smart and that we are very cautious. I think the governor is really weighing all this. It weighs heavy on him, these decisions, but I really hope and pray that people will continue to do what they're doing. They're doing a good job. We just need to stay on course for right now.
Martha, let me ask you, I got tested yesterday in the drive-through testing site at Walmart, and it's really not because I'm showing any strong symptoms or anything like that, but I had a couple of days where I had a headache. I had a little bit of a fever. The fever's gone. So I was like, it's now open to the public if I meet the criteria, and online I met the criteria, but I'm feeling guilty about going. What is your advice to people who maybe have had a couple of the mild symptoms, but yet I didn't want to take a test from somebody who really needed it? How do you respond?
I think it's okay if you're having symptoms like that to go ahead and get tested. For one thing, it helps what you can do with your behavior. My issue is people who have no symptoms wanting to get tested, and the reason why is this. Say you were exposed and you're trying to see whether you can go out and about or be around your friends. You may not have a high enough viral load right now for that test to be positive, but you may have it tomorrow or the next day. So that negative that comes back is a false sense of security. If you had symptoms and you're feeling better and you want to see, do I still have it? Did I have it? That's one thing. But if you're just trying to just take a test, I don't think that's smart, because I think it misleads you in a way that's not necessarily safe for you or your family.
Dr. Martha, for inveterate worriers who border on hypochondria, like Aaron McCarty.
No, other people. He's talking about other
people. For inveterate worriers, unlike Aaron McCarty,
Yeah,
who border on hypochondria, who took the test because they have these imaginary symptoms in their minds.
It wasn't imaginary.
Then why are you at work? But we won't talk about that now. For people like Aaron, who may or may not be creating symptoms in their head, when you tell those people, well, just because you came back negative doesn't mean you're really negative, you do understand that she's going to go get in line again. So my next question is, how often are you allowed to test yourself? If she wants to do it every day, is she allowed to?
She's
That's
not.
that's not a good use of our resources. But what I'll tell you is really, just pay attention to your body. If you're having fever, if you're having sore throat, if you're having headaches, GI symptoms, muscle aches, that's what we're seeing first, and then a cough comes later. If you're having symptoms, then please make sure that you get tested, because we want to make sure that you are safe and that you're keeping your family safe and the people around you safe. If you just have a headache and a little sneezing, it's allergy season and pollen is terrible. Give yourself a day or so, see if you feel better, with no fever, and if that's the case, then don't waste a test. But it's a question that everybody's asking. We really want to make sure that those people that are sickest have the ability to get the test. But luckily, right now in our community, we have multiple sites to test at. So I think you did fine, Miss Erin. Don't worry about it. I think as long as you felt like you had symptoms, it's reasonable to get tested.
No, we got to get going here. I just want to say, since you mentioned it, I do have one symptom. It's muscle ache, and it's a pain in my butt. And it's caused by Aaron. Dr. Martha Whyte, Regional Director, State Department Office of Public Health. Thank you, Dr. Martha. All the best. We'll talk to you soon.